This conference will now be recorded.
Good morning, students. I'm audible to you. Good morning, everyone.
Yes.
Anyone? Thank you. So, this is the small topic we are discussing toxicology topics, and at the same time, they simply have to remember. But remember, in the examination part, it is general topic. It is the therapeutic drugs, and it's here. Come to the point. The OTC drugs, and these are the drugs which are called as the over-the-counter drugs. OTC. See, the medicines sold to consumer directly without a prescription from the registered medical practitioner. And the term OTC drug has no legal recognition in India. It is also known as the no prescription drugs. But actually, any drug has to be prescription in worldwide foreign countries like a prescription in the drugs. But in case of India, some drugs, not only we are discussing about the OTC drugs, but number of drugs, whether any drug, cardiology drug and neurological drug, every drug will be given by the RMP as a OTC drugs. So you have to remember these rules only for your legal medicine. That means especially our MBBS and our medical people only. But any drug will be given by this RMPs, and directly they are giving the steroids continuously and the long run period to the people who are in the village people. Because of that, steroids, they are long for a longer usage of these drugs, and that is the drugs which are not prescribed by the should not prescribed by the RMPs. Also, they are prescribing these drugs continuously. They are using these steroids. Also, they have, because of that steroids, they will get the temporary relief of the pain or whatever it may be the problem. But in the long run, they have its side effects. Like suppose, for example, steroids they are giving, they are going to become a diabetics also. And steroid overuse, steroid abuse, and because of that steroids they have some many side effects of this will get by the people. So the drugs will be OTC, means over the counter, and these drugs will be given by the prescriptioners and as well as the medical pharmacy people also. See, what are the OTC drugs? You can remember common examples and OTC drugs: the paracetamol and aspirin. So paracetamol, if you know, it is an analgesic and for the antipyretic. So this is the main drug they are giving in as a OTC drugs. Paracetamol and aspirin, the anticoagulant drug, and cetirizine. You know, these are the simply they are giving for the cold and then other allergic reactions. And antibiotics like azithromycin, ciprofloxacin, and metronidazole, and ointments like betadine, and antiseptics like Dettol, Savlon, and come to the cough syrups. Cough syrups also, and diclofenac, the painkillers, clopidogrel, analgesics, and antacids, and proton pump inhibitors like omeprazoles and pantoprazole. And these are the drugs commonly given as the over the drugs and OTC as a OTC drugs. And whenever you have the problem like and acidity or pain or anything and cough and cold, you will go to the, if you go to the pharmacy, they will give directly, or the medical practitioner like RMPs that without any prescription we can give these drugs. And more recently, the sexual enhancement drugs like sildenafil. This is the more sexual enhancement drugs. They will improve the sildenafil is the drug which is improves the circulation at the area of the sexual organs, and they will improve the sexual power of a man. So these are sexual enhancement drugs like sildenafil. Previously they are not giving, but now they are also given. Sildenafil has the side effect that is hypotension or something. So you have to see for this hypotension. Why? Because sildenafil is a vasodilator. By that it will improve the sexual and power also. So sildenafil has the main side effect is the hypotension, when the people who are hypertensive, when they are using this drug, we take the care of them. And emergency contraceptive pills and alprazolam. Alprazolam, the anxiety drug, and this also now it is used as the over the drug. Okay. So these are the drugs: paracetamol, aspirin, cetirizine, and antibiotics like the cough syrups, diclofenac. All of you know, I think these drugs are giving the over the as a drugs over the counter drugs. And commonly abused over the counter drugs are cough syrups, paracetamol, and analgesics. And these are the drugs which are abused by the people. There was a cough drugs. It has the generally they will take you if they have cold or cough. Continuously they are taking this drug. So in this codeine, like this, some drugs, they have the addictive or abusing nature. Cough syrups especially, and paracetamol. Generally, for any vein they will take in villages, whatever it may be, villages or towns. In any simple pain or fever, immediately they will take the paracetamol. Addict అయిపోయినట్టు ఇది చేసుకున్నారు. Analgesics and alprazolam. The anxiety drugs definitely it has abusing and addiction కూడా ఉంటుంది alprazolam. So these are the drugs it is commonly abused, right? And now come to the what is the paracetamol poisoning. So any drug or any drug, if you take the more than its dose, it will become a poison. So like that, paracetamol, if you take the more quantity, it will become a poison. And generally it is a available drug kabatti suicidal tendency unnavalla they will take as a paracetamol as a poison. So the synonym of the paracetamol is the drug is acetaminophen. Most widely the used over-the-counter analgesic in the world. So its overdose is also common. So maximum paracetamol అనేది అందరికి తెలిసిన డ్రగ్ కాబట్టి automatically they will take this for the pain కానీ fever. The accidental poisoning in the pediatric group, accidentally they will take the paracetamol syrup కానీ paracetamol overdose తీసుకున్నప్పుడు a poison it may cause the accidental poisoning. So in this paracetamol poisoning, death due to the paracetamol poisoning is uncommon. Within time automatically it will be recovered. And what are the uses of this paracetamol? That is medical significance especially. So it is used as an analgesic and antipyretic drug most throughout the world. Analgesic and antipyretic, and major component in the cold and flu preparations. Cough syrup, cough and cold, generally they will get the fever. So that's why it is a major component in the cold and flu preparations. And come to the mechanism of the toxicity, you can think, see, acetaminophen, it may be acting by through these NAPA enzymes, and they will be go through the that means excreted through the urine, but it may cause this NAPA para-benzopyraninoin. It causes severe centrilobular liver necrosis, and not only liver necrosis, it may cause the renal tubular necrosis. This is the acetaminophen. If you take in a larger toxic, a larger quantity, it may be causes a liver necrosis and paracetamol poisoning. So come to the fatal dose of this paracetamol poisoning is 20 to 25 grams. Is the in general paracetamol you can take 500 mg paracetamol tablet as 4 tablets per day. That is 4 times this goes 4 times. But more than that, it will causes the poisoning. 20 grams to 25 grams is the fatal. But doctors suggested the 4 times the work this coach. But more than this 20 to 25 grams is the fatal dose, and as a single dose 20 to 25 grams. And fatal period may be 3 to 4 days. And immediate signs and symptoms of this poisoning, that when a person taken more than this dose immediately as a single dose, it may causes the nausea, vomiting, abdominal pain, hypotension, tachycardia, and dyspnea. So renal failure may be occur within 24 to 72 hours due to the renal papillary necrosis. So most probably the poisoning of this paracetamol, you have to remember the liver necrosis. You have to centrilobular necrosis, and the renal failure also was renal papillary necrosis. After 24 hours, what is the effects of this paracetamol poisoning? Is signs of liver failure. So liver failure, liver failure, but at the same signs and symptoms, and they may develop the jaundice especially. So it may lead to the vomiting, jaundice, hepatic pain, and hypoglycemia, confusion, common metabolic acidosis, and course of flapping tremor of the hands. Hysteresis అంటారు దీన్ని hysteresis. And remember the in case of the paracetamol as well as the aspirin poisoning and metabolic acidosis is the common thing. You have to reduce this. And to counter the acidosis, you have to give the carbonates evolution. Metabolic acidosis, you have to remember that within the 3 to 4 days it is continues this toxic effects. It may lead to the death of an individual. So come to the treatment aspect of the paracetamol poisoning. The gastric lavage you have to do activated charcoal with the activated charcoal. Gastric lavage you have to done, and the antidote is the N-acetylcysteine is the antidote for the paracetamol poisoning. Maximum efficacy if it is used within the 8 hours of taking the paracetamol. That another person as a suicidal or incidentally, if you take the paracetamol, if the person taking the paracetamol more than the 25 grams as a single dose, immediately within the 8 hours, if you take the antidote, he will be survived. So that means he will be safe. And N-acetylcysteine is it is an entrance question. You have to remember N-acetylcysteine is the antidote for the paracetamol. Next, come to the dosage of this antidote. 140 milligrams per the kg per BD, and followed by the 70 milligrams per kg body weight. That means body weight, that is BD, and every 4 hours for the 3 days orally. Maximum 18 doses you have to give this antidote. So next one, that is the methionine. It can also be tried, but less effective than the N-acetylcysteine. This is also methionine. Also, it is the antidote, like it will give the antidote effects to the paracetamol poisoning, but compared with the N-acetylcysteine, it is the less effective. And activated charcoal should not be given as whenever the along with this methionine, and correct the asthenia. So it's a metabolic acidosis, you have to correct it. And liver transplant in case of the non-responsive cases and asymptomatic. So forced diuresis and one of the treatment in this paracetamol and aspirin poisoning also forced diuresis ఉంటుంది. And last cases, that means it is not responsive to this treatment also, liver transplantation, and otherwise it is the symptomatic treatment only. Come to the autopsy findings. So already we discussed this is a paracetamol poisoning. Most probably it affects the liver. That means it is means the liver is enlarged. You are doing the abdominal dissection, and you open up the abdomen and the internal organs you have to see for it. Especially liver and kidney are affected in this paracetamol poisons. So liver is enlarged, alloyed with the features of central lobular necrosis, and kidney will be shows the the section if you do, it shows the tubular and papillary necrosis of the liver and cerebral edema. These are the main autopsy findings in case of the paracetamol poisoning. And remember the forensic significance and medical legal significance of the paracetamol poisoning is most probably it is a suicide poison. So it is available in every house. The paracetamol at every home, they will keep it as a simple medicine. That means first aid kit laga andaru illalo untundi kabatti they may be taking it as a suicide. It's a common thing. Accidental poisoning may be in case of the kids, that is accidentally they will take the syrup or tablets and they don't know about that, and they will take it as they will take orally. It may lead to the accidental poisoning. It's a common. So come to the aspirin. Another drug, that is aspirin, is the over the counter, and it will be useful in the, as a anticoagulant drug. And the synonyms of acetyl salicylic acid is a drug, and it is a acidic and bitter in taste. So come to the medical aspects of this aspirin. Is an antipyretic and analgesic and as an anti-inflammatory drug. Antipyretic, analgesic, and as an anti-inflammatory drug. So it is main prevent the clot formation in risky individuals, especially in case of the adults or the more than people who got the heart attacks at MI gani, and there is a chance of above 45 years the people there is a chance of the clot formation in the blood, and they will give it as the drug for the prevent the clot formation. heart attack patients can less center, and at the same it will be combined with this clopidogrel, that is anti-lipid drugs to kalpukoni istha untaru, aspirin. So it is an antipyretic, analgesic and anti-inflammatory drug, and to prevent the clot formation with individual risk people. So come to the mechanism of this, it inhibits the prostaglandins synthesis. So aspirin, it blocks the synthesis of the prostaglandins. See, you can see the in case of the arachidonic acid metabolism. So the COX-1, this enzyme, it may lead to the formation of the thromboxanes. So at the same time, in case of these enzymes may lead to the in generally they will form the thromboxane, means a clot formation. So whenever the aspirin takes, it blocks the COX-1 enzyme. By that it will influence the formation of the thromboxane. By that it causes the reducing clotting. So this is a mechanism, arachidonic acid mechanism. It acts on this, especially in the platelets and the blood vessels by this aspirin, and it blocks this COX-2 here in the blood vessels and maybe lead to the reducing inflammation at the level of the blood vessels, any accidents. So by these two mechanisms, aspirin causes the reduced clotting, and it prevents the formation of the clots, and it causes the reduced inflammation in case of any trauma or accidents. By these two mechanisms at the level of platelets and blood vessels, it blocks the COX-2 in the blood vessels, and it blocks the COX-1 enzyme and lead to the it affects the thromboxane mechanism, isn't it? This is the mechanism of action of the aspirin. Aspirin poisoning. So it may lead to the burning pain in the mouth and stomach, nausea, vomiting, and diarrhea. So whenever a person taken as a poisoning or accidentally or suicidal couch. So or accidentally you may take some people, they will forget a tablet తీసుకున్నారు లేదా మర్చిపోతుంటారు. So in that, as in old age process లో what happens, they will forget and amnesia వస్తుంది. So they will take number of times this tablet may lead to the poisoning. So it leads to burning pain in the mouth, stomach, nausea, vomiting, and diarrhea. And audiovisual symptoms such as ringing in ears, vertigo, and impaired vision. So the central nervous system symptoms are severe headache, irritability, confusion, disorientation, delirium, hallucinations, and convulsions. The signs and symptoms of the aspirin poisoning. So what are the metabolic symptoms due to the aspirin poisoning? Is it causes due to stimulation of the respiratory center. It leads to the respiratory alkalosis with the hypercapnia and loss of carbon monoxide, which followed by the metabolic acidity due to the excretion of the bicarbonates, sodium, and potassium. So it may lead to the respiratory alkalosis with the hypercapnia, and this also entrance goes in your metabolic acidosis due to the excretion of the bicarbonates and sodium and potassium. So urine is strongly acidic and severe dehydration, hyperpyrexia may be caused in these cases. So in blood disorders, it will lead to platelets dysfunction and the hypothrombonemia. So it blocks the COX-1 and may lead to the hypoproteinuria. By this, it may be leads to the clot dissolving because of this aspirin. So others are moist skin and pupils are dilated. So increased anion gap, metabolic acidosis with respiratory alkalosis, ketosis, and tinnitus. These are the typical symptoms, signs and symptoms of the aspiration poisoning. So remember the entrance question: increased anion gap, metabolic acidosis with respiratory alkalosis and ketosis and tinnitus. These are the aspirin poisoning typical symptoms and overview. And come to the mortality rate is 7 to 8% only, and death due to the in case of the earlier stages, it due to the acidosis and uremia with peripheral circulatory failure, and later stages it because of the respiratory failure. So in some cases, a sudden cardiac arrest also possibility. So this is the death due to the aspirin poisoning. And come to the typical syndrome due to the aspirin. This is the Reye syndrome. Remember, it is the rapid onset of hepatic failure and encephalopathy, and associated among children less than 15 years who takes the aspirin during the viral illness. You can see this is the Reye syndrome in viral syndrome. ఈ అమెరికాలో కూడా ఈ మధ్య Reye syndrome చూసారని చెప్పారు. Why? Because of the COVID viral illness వల్ల they are taking they are giving it as a medicine in these people also. So because of this Reye syndrome, it develops the Reye syndrome and a rapid onset of hepatic failure and encephalopathy associated with the among children less than 15 years who takes the aspirin during the viral illness. Reye syndrome is a typical syndrome you have to remember, and along with it, you can go through the textbooks also, Reye syndrome about this. And come to the aspirin poisoning and treatment, its management of the aspirin poisoning. See, as usual, gastric labs you have to do, and you can the activated charcoal and IV fluids to increase the urinary output to counteract the metabolic acidosis. That means forced diuresis. IV fluids to increase the urinary output, forced diuresis, and by this forced alkaline diuresis by the sodium bicarbonate. The main treatment in case of the aspirin, forced alkaline diuresis by the sodium bicarbonate, and peritoneal dialysis and hemodialysis, and not responsive cases, and alkali therapy, and vitamin C is going to counteract the hemorrhage. So because of the aspirin is overdoses may lead to the hemorrhage. So to Students, sorry for the disturbance. I'm audible to you?
Yes, sir.
Okay, come to the autopsy findings in case of the aspirin. That is external symptoms are you can observation. The dilated pupils and the skin rashes can observe. Internal organs, the condition of all the internal organs and petechial hemorrhage is also seen in the various organs. Stomach and shows the mucosa congested and may be eroded, and back altered blood may be found because of the slow hemorrhage. So these are the autopsy findings. In case of the aspirin, the typical findings in the stomach findings you can see mucosa congested and may be eroded, and black altered blood may be seen because of this slow bleeding and hemorrhagic. So medical legal significance come to this. It is always a suicidal thing. And come to the another over the counter drugs is a cough syrup abuse, and the mainly due to the dextromethorphan component in the cough syrups like dextromethorphan to suppress the cough, especially the dextromethorphan component. It is mainly used for the treatment of dry cough as a THCM is the cough suppressant dextromethorphan. So that comes to under morphine category and has got the sedative and dissociative properties. Sometimes because of this dissociative property of this dextromethorphan, it will have the and dissociative anesthetic drugs ketamine like this dissociative properties ఉంటాయి అన్నమాట. అలాగే different ఒకసారి they will have the memory loss ఉంటుంది, hallucinations రావచ్చు, and they forget different type of the psychological problems dissociative property ఉంటుంది, memory loss ఉంటుంది, as well as the as a hallucinations కానీ delusions they will be developed. So these cough syrups that are dextromethorphan come under the morphine category and they got sedative and dissociative properties. Mechanism of action: the NMDA methyl diazepine receptor antagonist, the serotonin reuptake inhibitor. This dextromethorphan will be act at the serotonin reuptake inhibition. See, the dextromethorphan, when used recreationally, the psychological dependence will be occurs. The people who are repeatedly use these cough syrups consist of the component dextromethorphan. They have the psychological dependence. Effects similar to the dissociative anesthetic like the ketamine. So already know this ketamine is a dissociative anesthetic drug, and they will have the dissociative properties. So in case of the mild to moderate cases, the person taking repeatedly these cough syrups, feeling of increased energy and confidence in the starting stage, a feeling of increased energy and confidence. The distorted body perception and dissociation and excitement and euphoric in response to the music and loss of sense and time. These people, the immediate or moderate doses whenever the person taken, the signs and symptoms are like this. And if he take moderate to severe doses, the person taking, they will be develop this hallucination, dissociations, and blurred vision, inability to the focus eyes, paresthesia, muscle spasms, and urinary retention, and shallow respiration, hypotension. Management for this is to stop the usage of that cough syrups and the symptomatic treatment. They can go through this, isn't it? Come to the cough syrup abuse. That means nowadays another component, that is codeine phosphate. Codeine phosphate, because this is the component of the cough syrups. It also used as a cough suppressant, and it is the opioid derivative. That is dextromethorphan is the morphine one, but this codeine phosphate is the derivative from the opioids. The signs and symptoms as usual management similar to the opioid addiction. You go through the textbooks and opioid poisoning. And syrup is a cough syrup. It is also cough syrup. It drink syrup. It is a drink made up of codeine. It is a drink made up of codeine plus promethazine cough syrup, and soft drinks like the Sprite and Mountain Dew. They consist of these cough contents codeine and promethazine. They are highly addictive and illegal. So the famous singer Justin Bieber was once arrested for this that more usage of drinker, isn't it? That is accusal. Who are this? Who is talking? Please mute it. Who is this? Next, come to the Alprazolam. Mostly, this is also a abusive drugs, and the people who are not getting the sleep and who are the psychological stress, they will taking the Alprazolam, and as over-the-counter drug, they are giving this. But previously, it is not given without a prescription from the doctors. Now it is usually it is given as a over-the-counter drug. So Alprazolam, short-acting benzodiazepines. So most prescribed drug in the 2010 most probably used. So it is used for the panic disorders, anxiety disorders. Who are the people in the stress and not getting the sleep, they will automatically they will take the Alprazolam, anti-anxiety drug, and abused mainly for its sedative, hypnotic, and amnestic properties. So it has the sedative property and hypnotic and amnestic properties. Alprazolam, and it consists of this. Because of this alprazolam, whenever they taken, it may lead to the overdose. It causes drowsiness and lightheadedness, dizziness, irritability, and targetiveness, changes in the sexual drive or ability, changes in the appetite also, sleep disturbances, and memory problems like confusion, hallucinations, and severe skin rash, and in other weight changes. It most probably the people who are taking this alprazolam and yellowing of the skin and eyes, dry mouth and increased salivation, and seizures, weakness, problems with the coordination, and the stomach problems like the gastritis may be uh, developed. So these are the signs and symptoms of, because of the overdoses of the alprazolam. They are taking people who are continuously alprazolam. And come to the treatment aspect of the alprazolam is, in case of the acute poisoning, you have to decontamination, stomach wash may be helpful within the 6 to 12 hours of the ingestion. Activated charcoal can also be given to the usual manner, and establish as a clear airway, oxygen and assisted ventilation if necessary. So that means ABC, you have to do the airway and decontaminate it, and you have to uh, person, that means stomach wash have to do first as usual, and air establish the air clean airway and give the oxygen and assisted ventilation if necessary. Give the IV fluids, and flumazenil is the antidote which acts by the competitive antagonist to the alprazolam. Flumazenil is the antidote, you have to remember. And the common household poisonings come to this are the kerosene. Kerosene is the paraffin generally. It is a hydrocarbon derived from the petroleum distillates. So it is another product from the petroleum production distillation law. So what are the uses of the kerosene? Previously they are cooking purposes. Previously they are using, and oil lamps, and major component of the aviation fuel, and they use it to control the mosquito larvae, and they will spray this kerosene over the pools or dirty pools, and they may be that may drown this larva and these mosquitoes, and they will kill these larvae. And as solvents in paints and pesticides, these are the uses of this kerosene. And poisoning is then accidentally among the children in general. Signs and symptoms: kerosene is poorly absorbed through the GI tract. So inhalation leads to the headache, dizziness, and drowsiness in coordination. The ingestion of this kerosene may lead to the nausea, vomiting. If aspirated to the lungs, may lead to the pneumonitis and choking, and wheezing and breathlessness, fever, and ocular symptoms like itching with the lacrimation. The signs and symptoms in case of the kerosene poison. And a dermal the skin, cracking of the skin surface with a pain, erythema, and a blister. These are the skin symptoms which are due to the kerosene poisoning, isn't it? Come to the management of this kerosene poison. Kerosene poison is a gastric lag is contraindicated because it is less generally absorbed through the GI tract. and the liquid paraffin orally give to slow down the absorption of the ingested kerosene. So actually the kerosene is slowly absorbed through the GI tract. That's why if you give liquid paraffin, it will also slow down the absorption. By that you can avoid this poisoning, remove the contaminated loss, and keep airway clear to prevent any respiratory problems. And in severe cases, you can go for the intubation and mechanical ventilation. Continuous positive airway pressure. By this, you can clear the airway. And come to the autopsy findings in case of the kerosene poisoning. These signs of asphyxia is present. You can see for this. All the organs and internal organs are congested and shows the CSM with the asphyxia. And smell of kerosene in lungs and GI tract can observe, and particularly hemorrhages in the mucous membrane of trachea and stomach can observe this. These are the typical findings as in case of the kerosene. Come to the disinfectant in the household poison like phenyl, herpic, Lysol, and Domex. The composition usually cresol and derivative of the phenol. Already we discussed about the carbolic acid poisoning phenol, isn't it? So the disinfectant consists of the phenyl derivatives. And the household generally uses ఉంటుంది కాబట్టి accidental poisoning పిల్లలు తీసుకోవచ్చు or maybe suicidal water. So how to manage this disinfectants poisoning? When falls on the body, wash with the soap water and water or polyethylene glycol. This is externally you can wash it by the soap. When ingested, take orally the gastric layers with warm water containing activated charcoal, olive oil, or castor oil, magnesium, or sodium sulfate. You can do the gastric layers of this person who are taken these phenol derivatives like Lysol and Domex. Demulsions like egg white and milk you can give. They will coat the stomach wall and they prevent the absorption also. And the forced diuresis by the saline plus sodium bicarbonate solution, it also combats the circulatory depression and dilute the phenol derivatives or phenol. So most probably they will take this as a suicidal poison. And next come to the rat poisons. Rat poison rodenticides, you can call it as rodenticide. That means the poisons which are used to kill the rats. Chemically they are the zinc phosphide or aluminum phosphide. Already I think it is over in the general toxicology, organochlorine like in poisons, zinc phosphide or aluminum phosphide and rat poisons. So whenever the poison taken occurs, the management like this: gastric lavage with the potassium permanganate, activated charcoal to absorb the phosphine, and you have to give the antacid to relieve the GIT symptoms. Gastric irritation and gastric hemorrhages to relieve the GIT symptoms, you have to give the antacids and a liquid paraffin for the excretion of the poison, and IV fluids and dopamine steroids to correct the shock. There is no specific antidote for this zinc phosphide or aluminum. So by this management, you can save the patient, the person who are taking the rat poisons or zinc phosphides. So deodorants and antiperspirants usually contains ethyl alcohol in generally, sometimes aluminum salts, and accidental poisoning by the children. Small, they will take, they don't know about this. So how to manage this means, if it's contaminated with ice, you can wash the ice with the lukewarm water, and ingestion whenever you take it orally, you have to wash the mouth and drink small glasses of the water. Until a lot of glasses of water, it will relieve the symptoms by these deodorants and antiperspirants poisonings. Okay, with this household and common that's over the counter drugs, and generally you have to remember they may ask about if they want to ask paracetamol poisoning and aspirin poisoning, most probably, and alprazolam. They will ask these three you have to remember. Remaining are generally you have to remember this. Okay, with this household poisoning is over almost. Next class we have to go to the practical sessions. Next from next class onwards, take the practical sessions, isn't it? Okay, all of you, thank you. You can leave.